Hi, everyone. Thanks for joining the first phPIN webinar in 2020. My name is Ariane Reeves, and I'm a public health nurse, public health advisor with the Division of Performance Improvement and Field Services in CDC's Center for State, Tribal, Local, and Territorial Support, or what we call CSTOT. CSTOT supports 3 programs with NMPHI on workforce development, and they are the Public Health Improvement Training, or FIT, which is happening June 2nd through 4th in San Antonio, Texas. The call for abstracts closes Friday, the 31st, and registration is now open. We also work together on the Strategic Scholars Program. Applications for that program are now open, and this year we're focusing on resource management as one of the 8 strategic skills. And finally, phPIN, which I'm very proud to work with NMPHI on. I'm very happy to welcome today's presenter, Shania Turner, and she's from the Florida Department of Health in Pinellas County. Thank you for Shania for presenting today. Now it's time for my colleague at NMPHI, Megan Wolf, to go over today's agenda, some of the logistics, and tell you a little bit more about today's webinar. Megan, you're up.
Thanks so much, Ariane. So before we get started, just a few housekeeping items. So if you have any technical problems during today's webinar, we ask you to use the chat function, and you can chat me privately and directly so I can help sort that out with you. If you have any questions for Shania, the presenter, please use the Q&A function, and that'll help us keep those questions organized during the webinar. The session is being recorded and will be made available afterwards to everyone if you want to share it with any colleagues in your network. All right, so let's go ahead and get started. So today's agenda, we're going to start, I'll introduce Shania Turner, and then Shania will share her learning objectives and begin the presentation. After the presentation, we'll have a discussion question where we would love everyone's input on, and we'll also have some time for Shania to ask any questions from the audience. So as I mentioned, our presenter today is Shania Turner. She's the Health Equity and Planning Consultant for the Florida Department of Health in Pinellas County. Her office is in beautiful and sunny St. Petersburg, Florida. I think we can all be jealous of that this time of year. She currently handles the county's health department's strategic plan, quality improvement initiatives, and internal health equity efforts. Shania graduated from the University of Tampa in 2018 with a bachelor's degree in public health. And while she's employed currently at the Department of Health, she's working on her master's in public health from the University of South Florida. So Shania, I'll turn it over to you to lead us through the presentation today on internal health equity.
All right, well, thank you guys. Let's see, let me just request control. So I am Shania Turner, like they have both nicely introduced me. Today, I'm going to talk about some tangible and actionable strategies to address internal health equity. Before we dive into too much of this, I have a question, Megan, if you would be able to pull up that polling question. Thank you, about your familiarity with internal health equity. So if you guys could just answer that question, we will get started. So Megan, I'm not sure, but I can't see if people are answering or what they have answered.
Oh, that's interesting. Okay, so it looks like about 20% have said we do have a plan for it at their organization. About 40% are tied for we've discussed it or we've thought about it but haven't moved forward yet. And only one person so far has said they haven't thought about it yet.
Okay. Does that look like a majority of, it looks like we have 38 attendees. Does that look like a majority of them have gotten a chance to answer?
Yep, that's 82% of people that have voted.
Okay, perfect. All right, everyone, then we will go ahead and get started. There we go. So our learning objectives today are defining the concept of internal health equity, which we'll talk about. And I am going to share with you guys some different strategies that I have used in my organization to increase internal health equity. And in turn, I hope that you are able to apply those strategies to implement an internal health equity initiative in your own organization. So first, I want to make sure that we all have the same working definition for health equity. The World Health Organization defines health equity as everyone should have a fair opportunity to attain their full health potential, and no one should be disadvantaged from achieving this potential. I will note here that when talking about health equity with others, it's always a good idea to start with this shared definition, whether it's this one or a different one that you like. It just kind of helps everybody start on the same page. Along with these different graphics, this one's pretty popular. I've seen some other ones with apples. The Robert Wood Johnson Foundation has a nice one with bicycles. And in this one, we have equality on the left where everyone's getting the same thing, equity in the middle where everyone gets what they need, and we've completely removed the barrier on the right so that anyone and everyone has access. I think it just helps kind of solidify that idea of what health equity is. So I also want to kind of note the socio-ecological model as we move into the topic of internal health equity. This theoretical model demonstrates how health outcomes are impacted by various levels of actions, factors, and policies. Obviously, health outcomes and people's actions are influenced by someone's knowledge, attitudes, and beliefs. But as we take steps farther away from that person, we see how other people and certain structures also impact people's actions and their health outcomes. Interpersonal relationships with family, peers, friends, providers, and basically everyone else can change someone's actions. As we move farther away, we see that different organizational factors can impact health behaviors and outcomes. And even farther than that, we see community factors and policies come into play. I think that it's important to think about it through this model, and I'm going to show you kind of how I implement that through health equity. So the first kind of most distal level when I think of health equity is the structural level, where we have different structures and systems put in place that can either help or hurt health equity efforts. And I think about these as most easily changed through policies. So when you think about like health in all policies initiatives or Medicare for all initiatives, that's kind of what I'm talking about. The next level I think about is the community level. So this is where different groups and organizations provide different services and programs to populations to try to create more equal access and opportunity for disadvantaged groups. So there I'm thinking about nonprofits and local health departments and organizations providing services for specific populations. Once we get down to this organizational level, we as a public health community, I think, become a little less familiar of how to impact health equity. You know, and then the final level, the individual, personal, internal level, this gets kind of more on these diversity, equity, and inclusion efforts within an organization. But then the question is, how do you carry that into services provided to patients and clients in your facility? So I hope that we're going to kind of touch on some things that will help you understand and get a better grasp on what you can do within those level 3s and level 4s to see how to make an impact. So I'm going to go over some actions that I have taken within my health department that have helped me kind of move forward with internal health equity. That is having a designated staff member, taking environmental actions, creating space for cultural and linguistic competence. Of course, we can't forget training, also addressing the social determinants of health and having a health equity team. Some of this, like I kind of mentioned earlier, will start to fall into the role of a diversity, equity, and inclusion staff member or team, and that's okay, but a lot of it is kind of also focused more on health equity than just that diversity, equity, and inclusion effort. So I'm going to go through these actions in more detail. So the first one is having a designated staff member. Now I know that this isn't plausible or feasible for everyone in every organization, but having a staff member that has duties assigned for internal health equity is my #1 suggestion. First, that's because this shows leadership commitment. It's showing that they're invested in this movement, so much so that they're willing to pay someone to be involved in these efforts. That's how my position came about in my county health department. And it doesn't have to be a full-time job. My duties are split 3 ways with 2 other programs that I manage, but health equity is part of my position description. This way, at least in my case, I can dedicate time to this work, and this work does take some time. That's why I suggest having it built into someone's position. This is not something that would be ideal for someone to do on a volunteer basis, just because we all know once you set it up as a volunteer position, it kind of gets pushed to the back burner because maybe, you know, someone leaves and you're short-staffed or you take on other duties. So it's easier if it's kind of built into someone's job description. I spend a lot of my time in this area researching, looking for best practices, checking up on data releases and new information, and basically anything I can find on these topics. Like I said, we don't have tons of research and information in this area, as a lot of it is more geared towards communities as a whole instead of this internal lens. I also spend a lot of my time planning about some of these other actions that I'm going to talk to you about, and of course, evaluating and data collecting. So I have another question now. There we are. Do you think having a staff member to focus on internal health equity would be feasible in your organization? And Megan, you're probably going to have to help me with the responses when they come in.
Right, so it looks like almost everyone has voted, and about 50% say yes, a part-time staff member, about a third say yes, a full-time staff member, 13% say yes, but only a volunteer, and about 5% say they don't think so or no.
Awesome. Well, like I said, I am only part-time in this internal health equity work, so I think that is a great start. Like I said, it does take a little bit of time, but I also think that part-time staff is definitely doable as well. Here we are. All right. So the next part I want to touch on is different environmental actions. So the first thing is making sure that your organization has inclusive policies, which can mean a lot of things. And it's part of why having a designated staff member is important. In my organization, I sit on our board where we analyze new and updated policies, and I look specifically for equity and inclusivity within those policies. For example, I'm thinking about language accessibility. So do you have policies about providing materials in all the languages your clients might need, having access to interpreters when you might need them? Are those interpreters medically certified if they need to be? Is your system for client information set up to be inclusive for everyone, including maybe non-binary gendered clients? There's a million different ways to look at it. So I think it's important to have someone doing that. Even if you don't have someone in your organization specifically set for internal health equity, I think it would be a good idea to have someone who sits on your policy board to look at it through an inclusivity lens. I also wanted to touch on celebrations and events. Again, this might touch in that diversity, equity, and inclusion work. At my county health department, we have celebrations for things like Black History Month, Hispanic Heritage Month, LGBTQ+ History Month. Other examples might include Women's History Month or Disabilities Awareness Month, as well as so many more. I mean, there's a million different months or days or weeks that you could use to celebrate. We use these times to not just celebrate and get together, but we do trainings and send out materials and try to keep staff involved in thinking about these different groups. Allowing staff time to plan events like this as well as attend them is really important so that everyone can be involved in the inclusivity. I know sometimes staffing can be tight, but it is kind of a necessity for inclusion to have events like this, or at least, you know, a day or a luncheon, something like that. Another thing that you can do is make sure that your areas for clients and/or patients are welcoming. So this is things like making sure that signage is placed correctly and including that signage maybe in more than one language, depending on your population. Are the spaces that, you know, people are waiting set up for people who are differently abled? Have all the frontline staff been trained to assist clients with different types of needs? These are all different things to keep in mind. If someone's coming to you for services for the first time, they might already be nervous, and we want to make sure that we're not placing any more barriers in their way to receive services. I think I have another question here as well. Yes, so do you have diversity celebrations within your organization? And this could be, you know, a big whole month thing or just a luncheon, just something that, you know, notes that you're celebrating diversity and taking the time to put into it.
Okay, so it looks like about 75% of people have voted. We have almost 40% saying yes, multiple, about 10–15% saying yes, just one, and about half of us saying no celebrations.
Okay, well, that's pretty good. I know different organizations are kind of set up different, so it doesn't always lead to kind of having this different types of things, but it's always a good idea to at least think about if you are able. All right, so I have another question about the national CLAS standards, culturally and linguistically appropriate service standards. And I just want to know if you have ever heard of these before.
So it looks like about 80% of people have and about 20% haven't.
Awesome. Well, that's way more than I would have expected. So you guys all must be health equity, cultural and linguistic competence people, which is great. Taking efforts to move towards cultural and linguistic competence is a really great way to increase your internal health equity. Because if your staff aren't at least somewhat culturally and linguistically competent, then clients are going to be receiving different treatment than others, even if you or the staff don't really realize it. So these class standards, or the culturally and linguistically appropriate service standards, were created by the Department of Health and Human Services. And they're a really great place to start. I'm happy that most of you guys have already heard about them. They just kind of set up some ground rules for having culturally and linguistically appropriate services. So if you guys haven't heard of them, they have them all laid out nice on the website from the Department of Health and Human Services. I believe the sub-site is called Think Health, Think Culturally Health, or something like that. If you adopt these standards, it's kind of a really great way to start these efforts. Another great way about understanding where you are right now or how far you've gotten in this work is conducting an assessment of your services. In my organization, we do this every 3 years. We assess staff and clients' feelings on how the department is doing in this work. So it's always important to collect data and understand where you are, and so that you know where you've come from and where you're going. And doing assessments on these standards can really show you what you're doing and kind of maybe where you're lacking or where you're doing well. In partner with the assessments, we also give trainings on understanding culture and give out material to help staff understand when maybe someone is acting on different cultural beliefs and understanding where that might be coming from. We provide materials to clients in multiple languages. In my county, we have a large population of people who speak Spanish, but we also have a pretty good chunk of people who speak Vietnamese. So we also offer a lot of materials in Vietnamese as well. And another thing that I want to make sure I stress is if you're using interpreters, please make sure that they have at least some training. It's always awesome to have people who are bilingual or multilingual working with you and able to help, but having some training is going to make a big difference. One thing that I had never really understood was why that can be such a big deal, but some interpreters don't know that they're supposed to interpret everything word for word without any kind of analysis in between. These trainings are going to kind of get them on track with that, but also help understand some of the ethics behind being an interpreter and why it's so important. All of this can be especially helpful if you're providing medical services in your organization. Someone's health can be at risk if you're using interpreters that are not properly trained, because not only do we have a language barrier, but then you're looking at issues with health literacy, and you just want to make sure that you're kind of covering all of your bases there. All right, so while I'm on the topic of training, I want to mention some other trainings that I do within my organization. One thing I'm always proud of is that all of our new hires get an introductory training on health equity. This includes topics including the social determinants of health, cultural and linguistic competence and the class standards, health equity and what that means to us and our clients. And this lets all the new staff know that we're committed to this work. We want them to be informed about it. We want them to be able to understand and use it in their day-to-day life. So that's why we do it with every new hire. We also offer training specifically on the social determinants of health. I think it's important to make sure that staff know what they are and how they can come into play in their own lives, in the lives of their coworkers, family, friends, and of course our clients. This, I think, helps give them an understanding to make sure that they're taking those social determinants into consideration when it comes to client relations. For example, if a client shows up late to their appointment, it's critical to remember that maybe they were using public transportation or relying on someone else to bring them in because they don't have a car, or maybe they don't have money for gas. If someone can't follow their diet regimen, it's important to remember that they might not have access to the healthier foods. And when someone continually cancels and reschedules appointments, it's important to remember that maybe they're trying to work with their job to find a time to come in. Maybe they don't get sick leave for that kind of thing. And I think it just teaches our staff to kind of think through all that when clients do come in and do have issues. I know that, you know, we can't kind of make excuses, if you want to call it that, for everybody, but I think it kind of gives them this humbled thought process to think through that. Another training we use is implicit bias training. And I really like the addition of the Harvard implicit association tests with these trainings. I think a lot of different people use those tests when they talk about implicit bias. They kind of show that even when someone's consciously making the effort to go against these biases, you might not always be doing the best job, because our unconscious mind still makes a lot of decisions without the conscious mind. And the implicit bias training then just helps them kind of put that into perspective and use some tips and tricks to kind of combat that kind of stuff. I think I have another question here to ask about what kind of training your organization does. Is your organization training staff on any of these topics? And then if yes, are they staff required to take it, or is it just offered?
So it looks like about half of the people do have the required training. About 40% have it, but it's not required, and about 10% say they don't have this type of training.
Awesome. Okay, that's kind of what I expected. That's pretty cool. I think it's awesome that the different people do require it, because I do think it can be really important for all staff to get at least some exposure. All right, so then another thing we try to do in my organization is at least somewhat address the social determinants of health with our clients. So at my county health department, we provide a lot of different services, even including primary dental care and other clinical services. And while this is a lot and it is, I think, helpful to our community, we just simply can't do it all. So something that we try to do is at least provide information of resources to our clients. So we have tons of different organizations, and we're very lucky to have lots of people devoted to kind of touching on lots of different areas, including food banks and drives, housing, transportation help, you know, all of that good stuff. But it's letting our clients know and letting the community know that that stuff's available for them. And this helps kind of get them whatever they might need. Because like I said earlier, when you're helping a client and they have these other needs that maybe we can't address, there is maybe a different organization that can, and in turn, that might empower them to be more compliant with their medication or their diet or their exercise or whatever it is that we're kind of asking them to do. So the last part that I wanted to touch on is a health equity team. So not only are we lucky enough to have a staff member with my duties designated for internal health equity, but I also run a team to help me do this work. I have staff that volunteer and represent all of our divisions on this team. So this is just one thing that they do in addition to all of their regular duties. And there we work together on a lot of this information that I've already talked about. We action plan for these different initiatives that we want to put in place. We use the data that we've collected from different sources, from outside, from internal, our culture and linguistic competence assessments, other staff surveys, and we pull it all together. And that way I have help and kind of input from different types of staff that work in different places and different divisions, so that when we're trying to put something together for all staff or big groups of staff, we have input from other people to make sure that it is kind of going in the right direction. This team also works together on initiatives to help with the wellness of our staff. To me, I think we can achieve health equity if we're not providing access and opportunities to our own staff. Not only because I think it's important to kind of start where you are, but I also think it's important to remember that your staff is part of your community as well. One example that we worked on specifically was a quiet or meditation room for our centers. The staff really wanted a quiet space to go during the day that would be good for their mental, emotional, and spiritual health. They felt like that would be one thing that we could do for them that might make them a little healthier. This team also works with our internal, what we call green team, to support green initiatives and environmental health. This is that kind of same principle where I think that making sure that we're doing what we can to increase our community's environmental health is important. Things that we've discussed with them is using more efficient materials like recycled paper, lower energy light bulbs, having people with plants in their offices, or supporting recycling while at work. So I've made it through most of my content. I would like to open it up now to the questions that maybe we have gotten or questions that you have now.
Yeah, so we have one question from Tina. She asks, what kind of follow-up training do you do, if any, for staff after they take the implicit bias test?
Yeah, so I have a little training that I do, and it just kind of talks about, you know, your unconscious mind is taking in so much information. I think it's literally like 89,000 bits of information at a time or something crazy. And you can really only process like 40 bits of information at a time in your conscious mind. And then we go through some kind of like, they kind of look like optical illusions that show where your unconscious mind is kind of taking over and making you assume things that maybe your conscious mind wouldn't have. If you want, you can send me an email and I can send you the slide deck, Tina, if you would like to see the kind of training that I give.
We also had another question asking for the link to the Harvard implicit bias test, so we'll be sure to include that along with the webinar recording and the slides in the phPIN community online.
Okay, perfect, yeah. Yeah, those are good. They have them for all different things, race, weight, I even think like political party, gender. They're pretty cool.
All right, so we don't have any other questions at this time, but I'm gonna, of course, invite people to continue to write in if you have questions, but I also wanted to open it up to everyone. If you wanted to do a chat to all attendees, you know, if you have other ideas for integrating internal health equity into your organization or resources that you've used that are publicly available, we would love to sort of share resources, and we'll also include those on the online community as well. While folks are typing in, I do have another question from Heather. How do you engage in topics such as racism that can challenge people's individual beliefs?
So it is tough, especially when you're talking about the isms, racism, homophobia, that kind of deal. Luckily, I have a very supportive leadership team that kind of stands up for all of that good stuff. So I have an example. This year, we celebrated LGBTQ plus History Month in October for the first time. And we did have some staff who were felt negatively towards us doing that during work time. And our leadership team kind of did a really good job explaining in our public forum that LGBTQ plus health is public health, and it's important that we kind of address everybody in our programs and services. When it comes to racism specifically, we make sure that when we're talking to all new hires, and I give that training personally to new hires, that I specifically address it by name, you know, that these types of social issues, racism, homophobia, are contributing to some of our health disparities. And then we also have some really good kind of trainings and forums in our community in Pinellas County that give us places to kind of talk about that kind of thing.
Great, thanks, Shania. That's excellent to hear. Two other questions for you. So one is, do you have definitions that your agency uses for inclusion, diversity, and some of the other terms you might have touched on today that you'd be willing to share with us? And we can do this after the webinar as well.
Yeah, I can definitely find those afterwards. I think that we have it written into some of our policies, and we always share it when we're doing staff trainings and assessments and stuff, so that everybody's kind of working on those same definitions.
Great.
But I can definitely find those after.
That'd be great. And then one more question for now. So did you conduct any type of organization-wide needs assessment to establish a baseline for improvement? If so, what areas did you examine?
So specifically, we do conduct needs assessments for cultural and linguistic competence. So that includes a staff and a client survey. In our client survey, we collect data on clients who have felt that they have been either discriminated against or maybe not so blatantly discriminated against based on their race, their gender identity or sexual orientation, or their income, and then some open-ended questions to get some kind of feedback on that. And then within our staff, we ask about how do they feel that leadership handle cultural and linguistic situations? How do they address stuff that comes up in like the news or the media, kind of events and that kind of thing? And then how do they feel that staff is doing and treating other staff and then clients? It's a pretty long survey. That's not all that we cover. There's, I think, maybe about 38 questions in our staff survey. And then again, we leave some open-ended stuff to hear about what staff would like more diversity, inclusion, or other cultural linguistic efforts. I see you just asked if we could have an example of the survey. Yeah, I could probably pull out one of those and send it with the rest of the information. I also have a couple of resources I could share that got released recently about assessing the class standards within an organization that were pretty good.
Great, thank you, Shania. Okay, we have two other questions here. So how do you address that there has been a historic pattern of specific groups being hired for different job types? For example, women and people of color being hired for lower paying positions and men being hired for leadership positions. So I think the question is just sort of how do you think about that? How does your organization think about that? And are you or HR sort of doing anything to disrupt that pattern?
Yeah, so when it comes to recruitment, that is something that I have been delving more deeply into recently. But because we are a state organization, basically all of our recruitment and hiring practices are predetermined by the state. So all of our applicants go through the state of Florida like website that they apply through, and all of our hiring is kind of down to a T based on like different questions that are pre-laid out. So it's not, at least in my mind, it's not as easy for us to analyze the hiring as it is for an organization that maybe doesn't have to follow all of those guidelines. But it is something that we have talked about, especially when you're talking about the demographic makeup of your organization versus the community. I am really lucky to work in an organization that pretty closely follows the demographic makeup of our community and has for quite a while. But one thing for sure that I see is that people who work in public health, there seems to be a lot more females or women, especially in my organization. But a lot of times that lines up with the applicant pool that they have gotten for that position. So it's not something that we have kind of figured all the way out yet, but it is something that we're looking more into for our future endeavors.
Great, thanks. And one last question for now. So can you talk about, this is a related question, can you talk about the successes and challenges regarding recruiting, retaining, and promoting a diverse workforce?
Yeah, so that is pretty related. Another thing I will say is that we have never done a great job of recruiting in general. So all of this is kind of new to us. We just started doing things like job fairs and creating materials. One thing I'll say is when you're working on recruitment, just making sure to keep your mind focused on the different groups of people that you might see at a job fair or that might read your material. So I'm thinking like when we create materials to give to anyone in the public, our public information officers have to review them. And they make sure that we're keeping it kind of at a baseline literacy level so that we're making sure to kind of anyone would be able to pick up that material and understand it. When it comes to retaining, I think that is part of our cultural competency efforts when you're talking about a diverse workforce, making sure that everybody is comfortable and we make it comfortable for everybody to be involved in kind of working in our teams. And like I said, we have all these different celebrations and events. We've been working on adding to those as well to make sure that all of these different minority groups of people can feel celebrated at least some of the times.
All right, thank you, Shania. So that's all the questions we have for now. I'm going to move through a few more slides to wrap us up, but if there are any other burning questions, please feel free to write in the next minute or two, and we'll make sure to get to you. If not, you can always follow up with Shania or myself after the webinar. So I just want to thank Shania for the great presentation today, a lot of really helpful information, and thank you to everyone who wrote questions in. Those were really thoughtful, and we appreciate all the great engagement we've had on the presentation. So I did want to do a quick plug. So our next webinar is in February, and that's going to cover building a performance management system to strengthen quality improvement. But we are still looking for a March presenter. So if you're interested in presenting on something that your organization is doing or something that is really of interest to you, just shoot me an email and we can set up some time for March to give you this webinar slot for phPIN. And I just want to thank Shania again, and Ariane, and everyone who attended and took time out of their day today to come learn about internal health equity. It's extremely important, so I'm glad to see so much engagement on this webinar. Look forward to seeing you all again in February, like I said, and we will see you all soon if there's no other questions. All right, well, have a great week, everyone, and again, follow up via email if you have any questions, and thanks again for attending.
Thank you, everyone.